Okay, it's May 8th, and we are with Caitlin Massey, Development Director of Community Care Clinic in Boone. And the Community Care Clinic provides free health care for low income and uninsured people right here in our community. Of course, this is important because people without health care are less likely to go to the doctor, so they are at higher risk for disease simply because they can't afford the care. And they don't have this relationship with a doctor, which many of us take for granted if we do have insurance. And of course, this is a massive problem all over the country, but you guys are addressing this right here in Boone. Is that correct?
That is correct. Yes, we have almost 1,000 patients that we serve in the area, um, predominantly in Watauga County, but we serve counties all surrounding us, so it's not geographically restricted. People in Wilkes, Ashe, Avery have access to our services or beyond that. And we are trying actively to make sure all of our patients are staying informed and healthy during this time.
That's awesome. So, is it heightened? Is the need heightened right now during this COVID crisis?
So I think that it's just shifted what our needs are right now because we have moved 75% of our patients have moved to telehealth. And that way we can keep up with our case managed established patients and make sure that they're keeping up with their medicines, with if they're doing what they're supposed to keep up with their chronic illnesses. So it's just a different time for us. But it's so important because we as a community are only as strong as our most vulnerable population. So we want to make sure that we're continuing to give those services to those people in a different manner to stay safe.
Yeah, and I would assume that with people losing their jobs, unemployment going up, there's going to be a lot more uninsured people. I mean, are you
Yeah.
guys expecting that?
Yes, we are, and I think it's very important for people to know that they have a service in case that does happen. I actually had a life experience recently that made me lose health insurance, so I feel very passionate about that and letting people know that we have this because it's scary. It's scary to realize how expensive it can be without that support, and we're there for that.
How are you different from like the urgent care or the health department?
Yeah, that's a great question. So if I think of it this way, if you're going to urgent care, it might be because you have, a sore throat on the weekend and you want to get it handled really quickly, you get your medicine and you go home. There's no checkup, there's no physical involved. We provide primary care. So we have established patients that we follow up with, that we make sure that they're on track with if they have a chronic illness, if they're on track with what they're doing to take care of themselves. There's follow-ups, there's checkups. We also provide cardiology, neurology, gynecology. So we just make sure that our established patients have every single thing that they need, as opposed to if you go to urgent care, you go there, you get handled, and you're done. You don't have that relationship base with the doctor. And I think it's really important to have that relationship with us to make sure that they're doing what they need to do because we really focus on the preventative part. And the preventative part keeps them from the more expensive times of having to go to the ER or something worse happening. So I think really having this service in our community makes sure that the people who don't have their insurance can come here and get that support that they need for no cost at all.
Yeah. So, I see on your website that you guys really emphasize the meaningful connections that I guess the doctors have with the patients. Is that
Mhm.
right? Can you expand on that at all?
Absolutely. So I haven't mentioned yet that I'm pretty new in this. So I've in this organization, and I've been talking to everybody in the facility to get to know, everything about it because that's what I need to do. And one of the really cool parts was just hearing them talk about their patients and how much they care about them. Um, they really do have that relationship family aspect with each one of the patients that come in. They care so deeply for making sure that these people have what they need. For example, there was a person they were discussing that got a job and now has insurance, so they're not eligible for our services anymore. And to them it was almost devastating because they've built that relationship with that patient and they want them to continue to have the services that they provided because they're so passionate about their relationship with them. So I think that's a really big part of what community care clinic is all about, is just surrounding these patients with support.
Yeah, that's great. Um, just to touch on the telehealth thing again, that whole concept I think is kind of new to a lot of us.
Yeah.
What I've not done that before. I've just heard people talking about it, but what is that exactly? Can you give us in a nutshell, like what does that mean for you guys to be doing telehealth? What does it look like?
Absolutely. So right now, if a patient contacts us because something's wrong or they need to see us, we only bring people in for essential services like lab work. Obviously, you can't do over telehealth, but say that you do have a sore throat, or you can go over the symptoms with our providers on telehealth. It has to be on video for regulation purposes, and they can usually go through the symptoms like you would at any other doctor's office and be able to prescribe you what you need. One of our really big things right now is case management. So those are with our established patients, so they can do the telehealth to be sure that they're on track with everything that they need to be doing, checking in with them, following up with them, but not having to bring them into the office to be exposed to anything. Another really big part of the telehealth is our mental health services. So people who, I mean, this is a scary time when it comes to your mental health. I can't imagine having to deal with that, but be at home and isolated. It's a really great thing that we can be able to reach out and provide our mental health services over video like this, so that they can have someone to talk to and work through whatever they need to work through.
That's great. Yeah. Gosh, just in the mental health thing and being able to sit down and have a screen call with somebody is probably amazing for someone, you
Yeah,
know. And you can do that,
absolutely.
and you can do that anywhere and anytime. That's awesome, as long as you have
Yeah.
access. So if someone's out there and they need your services, what should they do? Where should they go?
I would suggest going to our website, ccclinic.org, and giving us a phone call and seeing what we can do for you. You have to have no insurance, so Medicare, Medicaid, no insurance at all. But other than that, you qualify.
And I assume the COVID crisis is affecting your funding through having to shut down some of your fundraising and money going everywhere else, you know, right now. But what are your greatest needs from the community in that regards, or how can people help?
So it's actually, that's a great question. On Tuesday is a new Giving Tuesday, which some people might have heard of. It's called Giving Tuesday now because of the pandemic. So we are doing a campaign right now for Giving Tuesday to kind of make up for what we've lost from not being able to do our spring fundraisers. We'll be doing a drawing for local business gift cards and some other things for anybody who gives to us on Giving Tuesday. And they can do that by also going to the same website and visiting our Facebook page, ccclinic.org, and our Facebook page is Community Care Clinic Boone. Um, so right now we're really just trying to raise money that we've lost from not being able to do our other fundraisers. And a really cool thing that I like is we have an adopt a patient program, which is either $25 a month or you could pay $300 a year, and it adopts a patient to make sure that we can give them everything they need.
Wow, that's great. Thanks so much for sharing, and we'll definitely get the word out there about what you guys are doing and the needs you have for funding. So thanks for joining us.
Thank you so much.